Welcome back to another episode of Pelvic Confessions. I am Dr. Carrie Howe, joined by my co-host and business partner, Dr. Jean Sharakabrad.
Welcome to the show. On Pelvic Confessions, we have conversations regarding women's health and pelvic health that women don't often have, but really should have.
We really want to open up the conversations of pelvic health, so we will be presenting a new topic every week and confessing what goes on in the clinic, things that women have shared with me, and as always, tips and tricks for pelvic floor health.
Yes. We've covered the gamut so far on the show. We're like 1,000 episodes in, I'm pretty sure.
Feels like
But we went from like big picture conversations to very specific topics like advanced beginner strengthening exercises for the pelvic floor. And we've got a lot more of that. But we had this realization as we're like talking about more topics and discussing the show and obviously talking about more information to share. And Karen and I had this epiphany. We're like, there's still a big question that we haven't really discussed.
like the main question.
The main question that she gets very frustrated with,
Yes.
and rightfully so. And that question is, and that's going to be kind of your confession today, is what is pelvic physical therapy?
Yeah.
More specifically, what is a pelvic physical therapist and what can a pelvic physical therapist do? Because I know she's very kind and she smiles a lot, but she gets very, very frustrated in the best way as an advocate for ladies dealing with pelvic issues. So let's start there.
Yeah.
What is a pelvic physical therapist?
Yeah, I think it's helpful to take a step back and just kind of debrief what the pelvic floor is, because that is what we treat as pelvic floor therapists. So again, if we have, I'm sure I've explained this hundreds of times in other videos, but I have my pelvic model that will sit at the base of your body. If you look inside of the pelvis, you can see muscles. So we have muscles on the inside at the base of our pelvis that kind of make a bowl. They line the base of the pelvis like a bowl, and they have functioning in urinary, bowel, and sexual functioning. These muscles also play a role in pregnancy and birth. And so starting there, what is the pelvic floor? And then a pelvic floor therapist is going to be a physical therapist who treats those muscles specifically. And we deal with a whole host of pelvic floor concerns, from leaking to constipation to pain with intercourse, prenatal, postpartum, pelvic organ prolapse, all the goods.
All the goods from
my perspective.
So I think the big summary piece is to start with a pelvic floor physical therapist is still a physical therapist.
Yes.
First and foremost. So you start as a physical therapist, you go through physical therapy school, and then pelvic is like a specialty, just like in MDs where you have your urologist, gynecologist. Those are specialties of the main profession, which is a medical doctor or an MD.
Yep.
Same thing with physical therapy.
Correct.
Right? You go to school, you learn how to be a general clinician, and then you go through training to specialize.
Yeah. So all of my training for pelvic floor physical therapy has been postdoctorate, right? So a lot of these accreditations and certifications and training are all postdoctorate, so it is an additional specialty.
Yeah. So there is, again, like any other specialties, there's clinicians that practice as part of a big practice. There's physical therapy practices that might have a pelvic floor as a service that they offer.
Sure.
We're on the other side of that spectrum in that it's our only specialty.
Yep. This is all I see.
Correct. So you might go to like a primary care physician and they might see you for a UTI, where else they might say, well, that's too much, go to a urologist or something like that. And we would be that referral, that we are the specialist dealing in the conditions that you talked about. So what's the benefit of seeing a specialist? Like, what's the benefit of going to a pelvic floor physical therapist versus going to a physical therapist if you have pelvic pain or back pain or something?
Right. Well, you're going to the provider who treats the source, right? Who has experience and expertise in training and treating those disorders of the pelvic floor. What's the benefit for women? I mean, pelvic floor health is so important, and it's an often overlooked underknown, underserved role of health.
Wait, women are underserved in health?
Yeah, surprise.
What?
So I specifically treat. I thank you for bringing that up, but I specifically treat women in female anatomy. Now, men do have pelvic floors. I think it's important to make that known. They have the same muscles, they just go around different organs.
Sure.
And that is kind of another subset of pelvic floor health. But yes, men can have issues with, leaking, especially post prostatectomy. They can have sexual dysfunction and pain with erection. So that is also something that a pelvic floor could treat should they have a specialty in treating men.
Yeah. So one of the frustrating points that we discuss, I think it's important, is one, the reason we do these videos is to help advocate for women that watch this, because most of the people that watch are women that are dealing with these issues or potentially might have symptoms of these issues. But one of the big things we like to also educate and advocate is other clinicians. So I think it's important to
Yes.
kind of highlight that if ladies go see their OB or GYN or even primary care physicians, they can say, "Hey, what about pelvic physical therapy
Yeah.
as well?" Right? Because that does create that relationship.
Sure. And, that's really our push here in the Howard County area, is wanting to connect and educate with those providers so that they know that pelvic floor therapy is a resource for their patients. I can't tell you time and time again how many women have found me kind of on their own search because they are having urinary leaking and the options they were given were surgery or some type of $3,000 laser procedure. And so they thought they were doomed to a life of leaking, and these women have kind of been their own advocates. But usually that's where we would like to see it start.
Yeah.
Right? Is a referral from those clinicians, because when women are dealing with these pelvic floor symptoms, they don't like to talk about them.
Yeah.
And maybe the one person that they'll talk to about them with is their GYN or their physician, if they're even open to conversing about these things. So we're really wanting to try to push forward in making pelvic floor therapy a standard of care for women with pelvic floor concerns.
Yeah. One thing we've heard several times at this point over the years is even women that advocate with their primary care or specialist MD, they'll say, "Well, what about pelvic physical therapy?" And they go, "Well, it hasn't worked, or you don't need that."
Yes.
For me, I think what I always recommend is to ask a clarification question. What is that based on? Did you have a bad experience with a pelvic PT that you referred to or worked with? What are you basing that on? Or is it something in research? Have you read research that says pelvic PT doesn't help? How do you approach something like
that makes my
easy?
sides
Easy, yeah. I saw this thing coming up.
Again, I've heard countless stories of women asking their physicians for referral to pelvic floor therapy, and they've been denied that. And it breaks my heart, because why would we not be promoting resources that are supporting women?
Yep.
Again, given an underserved population, along with pelvic floor being underserved. The one thing I want to make clear for women who are watching this is you don't need a referral
So important.
for pelvic floor physical therapy to get an evaluation. In all 50 states, we have direct access for physical therapy. That means that you can call up your local physical therapy clinic and get in even without your physician writing a referral. However, I'll put it with the caveat of some insurances do require a referral from your physician or a pre-authorization. So obviously it's important to know the scope of your insurance policy.
We'll talk about insurance in the future video,
right.
So hang tight.
But I do want to make it very clear that you can schedule an appointment for pelvic physical therapy even without a referral from your physician. And I think most people are unaware of that. And so when they're asking their physician, and unfortunately the physician for whatever reason isn't an advocate of it, that shuts women right down.
Mm-hmm.
Right. And so again, I could talk about this all day.
I know you could.
Of really wanting to push forward pelvic floor therapy to be that standard of care for women, for themselves and also from clinicians.
So 2 points to finish out with. Number one is I want to make sure that we set the right tone, and that it's not us versus physicians or other PTs. It's us versus unknowing, or the awareness piece that women can benefit. We're all about building allegiance and alliances to be a medical team for women because it's oftentimes more than just pelvic physical therapy,
Correct.
right? It's working with primary care and
Yep.
OBGYN and creating this true network for patients.
Yeah.
And that's when they really benefit and flourish in overall health.
Agreed.
Point number 2, we love to be proactive, right? We love to be ahead of the issues, like dealing with prenatal, helping women get ready, their bodies ready for birth. Pelvic PT can help with that.
Yep.
But oftentimes we also deal with the issues when they are happening or been happening for a long time.
Yeah.
And physical therapy is often called conservative care because we are a very effective but low risk option.
Yeah.
And that's evidence-based and proven, right?
Yeah. Research is going to back that up, that for many of these pelvic floor symptoms, pelvic floor physical therapy should be the first line of defense for treatment and conservative care. It's really relatively low risk. There's minimal risk involved with this treatment. And then to your point too, in terms of that kind of reactive care, again, let's let women know it doesn't matter if you've been dealing with this leaking for 2 weeks or 20 years. Pelvic physical therapy can help regardless of where you are at in that continuum. I will preach this till the day that I die, but a little ounce of awareness and mindfulness of pelvic floor health and ability to control that area down there goes a really long way.
Yeah. And to make the connection, bring it full picture ahead, we talk about physical therapy. People go to physical therapy when they're 80 or they're 10 years old.
Yep.
Right? It's never too early. It's never too old when you're dealing with muscular pain.
Yep. You don't have to have been pregnant or have a baby to have pelvic floor therapy. That's another kind of misnomer. I treat women who are in their young 20s who are having pelvic floor issues who have never been pregnant.
Yeah. So there's a lot of time frames and a lot of ways to benefit from pelvic physical therapy. We treat women, again, if men are having issues, there's pelvic physical therapists that help men as well. So there's a lot of specialists, just like any other specialist that work with a lot of populations. So if you're in the Howard County area or you want to consult with Dr. Carey virtually, you can head over to restorepelvicpt.com. You can head over to Instagram at restorepelvicpt or our YouTube page as well at restorepelvicpt. And you can see a lot more of these videos, and we have a lot more resources and content coming to help move the needle forward and get the message out for ladies and everyone else that can benefit with pelvic physical therapy. Well, hope you enjoyed that. At the very least, hope now you know what pelvic physical therapy is, and more importantly, what pelvic physical therapists can do and how they can help you. That's it for today.
Ooh.
Let's close it out. We've got only a couple more weeks left with our Irish mug.
This is our last week.
This is the last week?
Yeah.
I don't know any sense of time anymore.
Cheers.
Cheers.